Dear friends, I would have very much liked to be with you in Johannesburg at this year's Palliative Care Conference for Africa. I would like to thank the African Palliative Care Association and the Hospice Palliative Care Association of South Africa and all their committee members and participants for organizing this extremely important conference and for working so hard to improve the quality of palliative care across the continent. As we speak today, 36 million people die every year from a non-communicable disease, 70% of them in the developing world, which is least prepared to deal with this epidemic. Non-communicable diseases cause 63% of total deaths worldwide and are responsible for more deaths than all other causes combined. 80% of those deaths occur in low and middle income countries. So we are facing what the UN Secretary General Ban Ki-moon once described as a public health emergency in slow motion. The good news is that this epidemic of non-communicable diseases finally entered the corridors of the UN in September 2011 at the UN high-level meeting on NCDs. Finally, the plight of 36 million souls was acknowledged. Finally, the NCD epidemic was seen for what it is, a ticking time bomb that will affect the lives of over 360 million people in the next decade. As a result of that historic meeting, we now have ammunition to face this epidemic head-on, with an overarching target of reducing mortalities from NCDs by 25% by the year 2025. Since then, governments have adopted 11 targets, which focus mainly on prevention. While prevention and early detection efforts are the cornerstone to stem future cases of NCDs, what can we do about the 36 million people who need treatment right now? What about the millions silently suffering with pain and disability now? Developing countries who are struggling with establishing the proper infrastructure and human resources to fight NCDs and other diseases have let the issue of palliative care slip through the cracks. Even the phrase itself, palliative care, sounds very academic and gives the impression that it is some kind of luxury treatment, as if it is a choice. But when you see a loved one grimacing with pain for hours on end, day and night, you quickly realize that palliative care is not a choice. It is an emergency need, part and parcel of treatment, and a human right. So why is there such a severe shortage of palliative care in developing countries? The issue is certainly not due to a lack of resources, as many would imagine. All countries, even those in the developing world, are capable of creating and implementing effective palliative care strategies. And virtually every single government is capable of procuring morphine and other opioid drugs. So money is not the obstacle. Bureaucracy is. Healthcare systems in most developing countries are strangled by complex administrative procedures and excessive rules and regulations that are decades old. Rather than giving precedence to treating patients' pain, governments are primarily focused on drug control, addiction, and preventing the spillover of drugs into the black market. In the developed world, a doctor does not have to think twice about prescribing morphine to a patient with a terminal illness, but doctors in the developing world often have no choice but to stand by helplessly, unable to administer standard pain treatment. Not only do they face impossible administrative hurdles just to be able to prescribe 1 milligram of morphine, they are also usually not well trained in pain management. Unfortunately, this usually means that by the time a patient gets to a point where they are in unbearable pain, they are deprived of a chance to receive the urgent medication they need, all because of overly complicated and outdated political roadblocks. And if they are one of the lucky few to get treatment, chances are their doctors won't even know how to manage their pain effectively. When you see and hear someone you love suffering needless pain, you would understand that the risk of opioids reaching the black market, for example, becomes insignificant to the rights of the patient receiving pain management. So now we are faced with a baffling predicament and a huge disparity. Palliative care is the easiest and least expensive need to meet, yet access to it is severely restricted. As a result, millions of people are needlessly suffering with no relief in sight. We must ask ourselves, why are 27 million people in the developing world dying each year in excruciating pain from diseases such as AIDS and cancer, when simple, inexpensive medication could make them comfortable? Why are we still allowing our healthcare to be dictated by policies that are decades old? Governments and regulatory bodies in the developing world must shift their perception of pain management and create effective systems to deliver pain medications to those who need it most, in addition to making sure it is not abused elsewhere. One issue should not cancel the need of another. For this, we have many successful examples to look up to. Developing countries such as Uganda, Jordan, and Colombia have been successful at establishing palliative care programs. At the King Hussein Cancer Center, our palliative program has come a long way in just under a decade. What started as a small palliative care consultation service in 2004 is now the largest and only comprehensive palliative care program in the country for cancer patients, with inpatient, outpatient, home care, and consultative services. Our story is proof that even against the backdrop of a resource-poor developing country, excellence in palliative care can be achieved and maintained. While some progress has been made, we are still facing so many challenges in palliative care across the developing world. But I am gratified to see that the will is there. We just need to convert it into action to find an end to this humanitarian crisis of untreated pain. I would like to say it as it is. This is one area where we have no excuses. We are all armed with the knowledge of proven, affordable interventions. If countries from the heart of the developing world can do it, we all can do it. We must remember that with each second that passes, there is someone who is praying for an end to the unbearable pain he or she is feeling. I liken the situation to a thirsty man stranded at sea. He is surrounded by water, but he cannot drink any of it. Each one of the 27 million people in the developing world who will unfortunately die in agony this year has the right to receive the highest standard of health care. We are the voice of the millions who are silently suffering from untreated pain. There is no time to waste. The time is now. It is our moral responsibility to grant them their basic human right to live in dignity and without pain to the last second of their life and until their last breath.